For people diagnosed with heart disease or a heart condition, finding a way back to health can be the biggest challenge they'll ever face.
I just wanted to pull the covers up over my head and go to sleep.
Until the point where I actually saw it on the monitor, I really thought they were insane, that there was nothing wrong with me.
It felt like I'm never going to get well again. This pain is never going to go away.
These recovering heart patients showed us how cardiac rehabilitation is helping them achieve a better quality of life. They had to overcome some challenges to get there, but each has benefited from a customized program that addressed their specific needs and abilities. The patients we spoke to said cardiac rehabilitation let them take control of their own health. Hello, I'm Marilyn Mitzel. If you have had a cardiac event, you should know that getting into a cardiac rehabilitation program can help you recover quickly. It also reduces your risk of future heart problems or related procedures. Plus, it improves your health and your quality of life. We came here to the Duke Center for Living in Durham, North Carolina. This program is state-of-the-art based on the latest medical research. The goal is to help patients recover physically, mentally, and emotionally. Dr. William Krause and a team of dedicated specialists treat patients with a wide variety of heart ailments at this rehabilitation facility. He says that anyone who has undergone a major cardiac stress should consider cardiac rehab.
There's no question that cardiac rehabilitation makes a major impact on people's quality of life. It allows individuals to deal with their cardiac condition and yet incorporate appropriate and beneficial lifestyle modification into their daily lives.
Dr. Krause says the 5 key parts of a cardiac rehab program are making physical activity part of your daily life, learning about nutrition and eating healthier, managing your stress, medical therapy, that means following your doctor's instructions and taking your medications, and if you smoke, stop. These basics of cardiac rehab have become a way of life for Barbara, who's had an aortic valve replacement and a quadruple bypass. The surgery restored her blood flow, but left her tired and depressed. You thought you're going to come out of that hospital and it's going to be fine. What did that do to you emotionally?
I felt like I had failed somewhere or I had done something wrong. Because, as I said, I had all these friends that had had heart surgery or they had had stents put in and they bounced right back.
And what were you feeling?
And I was not doing any of that. I was regressing.
Barbara's cardiologist recommended cardiac rehab, a crucial referral that some patients may not get.
It's not okay not to go to cardiac rehab because your doctor didn't refer you. What is okay is to reapproach your doctor and say, I want to go to cardiac rehabilitation. Can you please refer me to my local program?
Do you think that you are in better shape now than ever?
Oh, yes, yes. I am in much better physically and probably mentally too. I'm not attributing everything to old age anymore.
And was there any family member in particular who was behind it?
Oh, my husband was very much behind it. I have a husband of almost 57 years who has been right there beside of me during all of this. He went as my partner, and I credit him for that, yes.
Patients come here to the fitness center with a wide variety of health problems they must rebound from. Exercise physiologists like Karen Craig help them rebuild strength and stamina.
Most cardiac rehab programs have activities that include walking, and that may be on a treadmill or a track, bicycling, maybe some pool activities. There's always some kind of stretching, flexibility component, possibly some strength training as well. How's the treadmill time going for you?
Rehab always begins with a careful medical evaluation, and every patient gets a program that is custom designed just for them.
We start at lower intensities, and then as they progress over time, whether it be weeks or months, then we progress them and get them back to hopefully a higher functioning level.
Along with exercise, nutrition is another component of cardiac rehabilitation. Choosing healthy foods is important for everyone, but it's vital for patients with cardiovascular conditions who may need to control their weight and cholesterol. Chad is a 43-year-old country club manager whose passion is opera. His recent diagnosis of heart disease and an emergency stent procedure came as a surprise.
The doctor had told me with the blockage that I had, the plaque breaking off, that if I had done nothing, that there was a very good chance that I could have ended up within 2 weeks of a heart attack.
That had to scare you.
That opened my eyes.
Chad threw himself into cardiac rehab, determined to prevent the kind of heart attack that killed his father just a year earlier. He knew he was going to have to lose weight.
I love food. I love all food. Going through some of the classes that I learned, the nutrition class, was very informative to me and really helped me say, what things am I eating? What things should I be eating? What things should I try to avoid?
Is there are a lot of different kinds of starches, and they're the ones we're going to refer to as the good ones.
For 20 years, Gene Erb, a clinical dietitian, has been teaching cardiac patients how to eat healthier. He starts by helping them separate fact from fiction.
The toughest part of getting people to make changes, I think, sometimes are misinformation. I mean, I'm there to teach information, but sometimes you have to undo bad information before you can get to the good information.
I learned what a portion was, that a portion is not this.
And in the end, I think they walk away with the message is, there's a lot I can do, and a much more positive approach to, I've learned a lot of things that I can do to be in control of my health, and they're very doable things that I had no idea about at the start of the process.
I'm very proud of the fact that over the last year and a half, I've lost about 25 to 30 pounds and kept it off for the first time in my life and feel very good. I just look forward to the best years of my life coming up. So I just feel like I'm hitting my stride.
When we met Jane, a pastor at a small community church in Durham, you'd never know she had 12 stents and bypass surgery. Were you scared?
I was, I think, more than afraid. I didn't know what to expect next. And I realized that I had so much to live for and that I wanted to live for. And
You're going to fight it.
I'm going to fight. I'm going to fight.
Jane goes to the fitness center 3 times a week for early morning workouts. And she takes her medications on a strict schedule.
When they began teaching you the importance and what each one of the medications is for, that helps teach you the importance of not just going off of your medications because you don't feel like taking it or you don't want to take it that day.
And managing stress, a major risk factor for heart disease, has become just as important for her as exercise, diet, and medication.
You got the eyes wide open. I don't pastor a huge church, and so I know all my members by name, and I know what's going on in their lives. And so their hardship, their hurts, their loss of a job becomes a little burden on me too.
Jessica Wakefield teaches meditation techniques as an effective way to reduce stress and even help regulate blood pressure. We talked with Jess about the different methods patients can use to help manage stress.
Often when we're teaching people about ways to manage stress, we teach them mind-body skills, such as different relaxation practices, breathing strategies, progressive muscle relaxation. Breathing deeply.
Cardiac rehab reminded me that every single one of us have a toolbox. I've got this toolbox that I can open up, pull out the correct tool, and readjust not other people, but me.
Barbara, Jane, and Chad, along with countless others, are successfully managing their heart conditions through cardiac rehabilitation. Remember that no matter what your condition is right now, you can benefit from a similar program. And know that you are not alone. With the support of your family, fellow participants, and rehab professionals, you can do this. So, is cardiac rehabilitation worth the effort?
You feel like you've got a little control over what goes on in your life, that your heart condition doesn't control your life.
It's the best thing I've ever done. It's the best choice I've made.
Well, I think cardiac rehab saved my life.
Taking the next step is easy. Ask your doctor or health provider how you can get into a cardiac rehabilitation program. Begin your journey back to heart health today. For more information about cardiac rehabilitation, visit www.cardiosmart.org.